Welcome to High Truths on Drugs and Addiction, where national experts bring you facts and answers. I'm your host, Dr. Ronit Lev, an emergency and addiction doctor who has served at the White House and still practices on the front lines. Right here on High Truths, you will learn from experts from around the globe and around all aspects of drugs and addiction. To grow this community of information and action, I hope you give us a 5-star review. Come visit me on hightruths.com to learn more about the show or download a free prescription for naloxone. Carrying naloxone for drugs is like carrying an EpiPen for allergies. Today's episode is sponsored by Physicians for Healthy Communities, a physician-led organization that educates on the science of prevention to improve public health. Visit their website to learn how they prevent substance misuse while supporting individuals, families, and communities. Go to physiciansforhealthycommunities.org. Hello again, High Truth listeners. Get ready for a global conversation. I'm your host, Dr. Ronit Lev. Global as in the whole world. Drugs affect our global population. Wars have broken out because of drugs. Great Britain and China went at it in 1839 and then a second time in 1856 in the First and Second Opium Wars, and up to 50,000 people died in battle because of drugs and the market for drugs. Great Britain was exporting opium to China, and China was begging them to stop addicting their citizens. Sounds familiar? What's happening now in China and the United States and fentanyl? In the aftermath of the Opium Wars, nations gathered and agreed that one country will not sell illegal drugs to another country. This is a United Nations treaty on illicit drug sales. Internationally, different countries have vast different policies on drugs. In Malaysia, you can be punished with death for selling drugs. And on the other extreme, Portugal has decriminalized small amounts of all drugs. You won't go to jail for having or selling drugs, but they still do not condone open drug markets. They have decriminalized, but they did not legalize drugs. But one country exceeds them all in terms of consumption of drugs, both legal and illegal, and that is a superpower, the United States. We have the world's largest economy, and we spend a bunch of it on drugs. To learn more about the global state of drugs, I've reached out to Amy Ronshausen. Amy Ronshausen has a global perspective on drugs. She has expertise in state, national, and international drug policies and strategies. In Florida, she was appointed by Governor Ron DeSantis to serve as a member of the statewide Council on Opioid Abatement. She also volunteers as executive director for the Florida Coalition Alliance, representing over 30 community anti-drug coalitions. Nationally, she's the executive director of both Drug Free America Foundation and Save Our Societies from Drugs, S.O.S. Internationally, Amy was elected as the president of the World Federation Against Drugs. To learn more about Amy Ronshausen, check out the High Truth show notes. Amy Ronshausen, welcome to High Truths.
Thank you. I'm so excited to be here.
I'm so excited to be with you too. We were just together recently in Vienna, Council on Narcotic Drugs, and you've been so generous in inviting us and the whole ISAC team, the International Academy on Science that Impacted Cannabis, to join you and to educate us into this another completely different perspective, the global view on drugs. So can't wait to share that knowledge with our audience. And let's start with getting to know you a little bit better. You are deeply involved in the issue of opioids, marijuana, prevention, treatment. How did all this come about? And really, you are our world expert in this.
Well, it's that's a question. How did this? Certainly isn't where I saw myself as somebody going to college. Like, what was I going to do with my life? This was definitely not even in the picture. But here I am, and I kind of fell into this space. I was just like looking for a job after I graduated. I graduated with a degree in humanities, which I think that alone tells you that I really had no job opportunities out there specific for that. And I ended up working at one of our local treatment organizations, Operation PAR, here in Pinellas County. It's one of the larger ones. And I started just doing phone interviews with people who were seeking services. And so it was very, black and white. I had to follow a script and ask them questions. And I really enjoyed the work, and I enjoyed talking with the people. I really enjoyed learning more about addiction and that it was a disease. And I had some substance abuse issues in my family growing up. And so for me, it was kind of, I wouldn't say it was a healing process, but it was definitely a learning process. My sister used drugs when I was growing up, and there was kind of on my end a lot of resentment there, and I didn't understand why she was using these drugs and why this was happening to our family. So as I got this job and I learned more about it, it helped me learn more about her and the impact to our family. And then I kind of stayed thinking that I didn't want other families to go through what we did. And my sister is fine. Let me put that out there. She has two lovely children and has a wonderful life. But it was hard on our family. So I thought this was a good space to make sure other families didn't go through that. And then as I've grown in this sphere, it's really morphed from helping families to helping individuals and helping them live a life outside their wildest expectations. And in order to do that, it has to be free from the burdens of substance use. And so it's just a very rewarding field to work in, not one that pays a lot, not one that you get a lot of thank yous for, but very heart driven. And so I'm very thankful for that.
That's great. Yeah, people who are working in this field are very passionate about what they do, get a lot of satisfaction, which is really nice. And I see that in you as well. So you deal with all issues of drugs, and it's hard to categorize just by substances, but I thought we'd do so anyway. Talk about opioids, marijuana, your global perspective on things, and then what you do with the United Nations. So opioids, and I know that you live in the state of Florida. You work on the state action on fentanyl. So what is Florida doing on the issue of fentanyl?
Oh, so much. So Florida was like the battleground for the beginning of this opioid epidemic that back then we were calling the prescription drug epidemic, right? That was probably
Florida was the, ground zero for the pill mills.
Yes, exactly. So that's where we started. And so that was probably around 2007, 2008, when I first started sitting in those meetings thinking, what are we going to do about these pill mills? And this is getting out of hand. And, we're the black eye of the United States right now with everything that's going on within our state. And, a lot of work went into that. It was a lot of coordination with our coalitions that we work with on the ground, our lawmakers, the different medical associations, our state surgeon general, everybody kind of really understood that this was something that needed to be addressed. And we did put some really great policies in place that ended up being, kind of like a hallmark for what other people did in other states. So we went from being the worst to slowly climbing that ladder and making a lot of progress. But even back in 2008, I remember sitting at a table and looking at the two ladies who were next to me, who just happened to be very high up in the treatment world and had been in this field, probably at that time, 30, 40 years. And I looked at them and I said, if we're going to make prescription drugs harder for people to get who are addicted to them, and I know that we need to do that, what are we expecting these people to do? Because they're not going to stop using drugs. We're driving them to the street. And so are we prepared for a heroin epidemic? And both of them said, yeah, that would be the smart thing, right? We would think ahead, but we're so focused on the drug of the day that we're just, working on that. And it was really hard. And here we are, 15, 16 years later, we've moved through the cycle of the heroin part of the opioid epidemic. Now we're at the fentanyl and the fentanyl analogs and the xylazines and things like that. And we're still here. Are we making progress? Absolutely. Are there a million more things we could be doing and doing better? for sure. But I think, and I'm excited because I'm in Pinellas County in Florida, and our midterm numbers show that we actually have a decrease in opioid overdose deaths for this coming year. And I believe it's by about 200. Now, that's just a little nick, but any kind of downward trend is really positive at this point because we haven't seen that to date. So I think some of those measures that we're putting in at the community level, doing the Narcan training, doing the naloxone initiatives and expanding it outside of our first responders, doing the evidence-based harm reduction practices that are leading people into treatment and into recovery. I think some of these things are starting to finally pay off. So we just need to make sure that they're continued to be funded and that they're continued to be worked on. And as part of that, Florida, I believe, has one of the biggest opioid settlements. Our amazing Attorney General, Ashley Moody, went after the pharmaceutical companies and got us groundbreaking results when it came to settlement funds for the state of Florida. And about a year ago, I was appointed by Governor DeSantis, to the statewide opioid abatement task force to make sure that these funds are being spent the way that they need to be spent in order to make that community change.
Wow. So that's a great accomplishment. And I came into this whole space when it came the problem with prescription drugs because I, as a physician, was part of the supply chain of that opioids. And I'm really happy to say that we no longer have an opioid prescription problem. At that time, we were screaming that there were 100 deaths a day. Though that was the good old days. Now we have 300 deaths a day. Things are much worse. And you mentioned that naloxone treatment has been your success in Florida. What about prevention? I know that you're very much into prevention as well.
So it's really, it's kind of a give or take here. Obviously at Drug Free America Foundation, our first and foremost priority is primary prevention. We know that 90% of addiction starts in adolescence. We know if we can prevent these problems from happening in the first place, that's less money we have to spend on treatment and other kind of services. But unfortunately, the prevention dollars have been hijacked by overdose prevention. And I in no means way that think that we should not be spending that money. We just can't be investing all of our dollars in naloxone at the expense of primary prevention. We need to save every life that we can in order to get that individual into long-term recovery and to have that family reunification and having them live that amazing life that they're meant to live. But we can't just like we say, we can't arrest our way out of this problem. We can't Narcan our way out of this problem.
I was just going to say that.
Our way out of this problem.
That's right.
You're
not going to naloxone our way. We're not going to Suboxone our way out of the problem.
No,
the way you get out of a problem, we just study our successes. If we study what we did with tobacco, if we study what we did with opioid prescriptions, it was front end. It was preventing the supply and the initiation. That's what got us to really move the needle.
Absolutely. And we know that prevention works.
Yeah.
We know that if we follow the science of prevention and the strategies that have been researched, we know that it does work. And so, but it takes a very thoughtful and savvy and caring lawmaker to invest money in prevention, because that's not something that's going to be fulfilled during their year in office. And so you really have to find somebody who's so passionate about this cause like we are, that's willing to fight for prevention and say, I know that this money needs to be spent, even though we might not see the investment and we might not see the outcome of this investment for another 15, 20 years. And you know how lawmakers are. A lot of times they want to see the outcomes of their work the same session that they pass that bill. But there are so many lawmakers out there who do understand this and who do believe in it. And so it's making sure that we're supporting them and giving them the data and the science science-backed talking points to allow them to fight for us, because that's what families need. Families need that information to help prevent their kids from using drugs. That's what the information that communities need. And that's the information that we're kind of obligated to give to the youth in our communities to make sure that they can make those informed, better choices for health.
So, Amy, how are you promoting primary prevention as a distinct program different from naloxone or other forms of tertiary prevention?
So what I'm trying to do as part of that opioid abatement council is I'm trying to make it so that, and some counties have done this, but I'm trying to make it a statewide thing, that they have to dedicate a certain percentage of all of the opioid funds to primary prevention. And so like in Hillsborough County, where Tampa is, they said that I think it's like 23% of the opioid funds that come into Hillsborough County have to be spent on primary prevention. But other counties haven't put that in there yet. So I've been trying to figure out a way that, like, this task force is kind of a joke, because all we're doing is reviewing how the money's being spent and making sure it's being spent in accordance with the state statute, which is pretty broad. But behind the scenes, I'm trying to talk to the different counties and saying, hey, here's a model you should follow. Dedicate 25% of these funds to primary prevention. That's still not the majority of it. I mean, I think 70% of it should be spent on primary prevention, but I'll take anything I can get as long as there's a dedicated percentage, so that you at least have to do something for primary prevention.
I'm really proud of our district attorney in San Diego, Summer Steffens, who's invested in just that. They spent a whole year in a voluntary curriculum in school for life skills that would prevent drug use, and invest in that and study that, because there's many evidence-based programs. So we used to have that in schools, and just like you said, addiction is a pediatric disease. That's when it starts. It's nice to see some communities now investing in that again.
Yeah, absolutely. And I think that sometimes people think that drug prevention is about talking about the harms of drugs. And yes, that needs to be included, but really it's about building those protective factors. It's about making sure that there's other choices that kids can make when they're bored, when they feel like their friends are doing these things, when they feel depressed,
Anxious.
A lot of,
Right.
yeah. And when, we have to acknowledge those feelings, we have to hear what they're saying, but it's our job as adults and the community to have these other resources there for them. So it's not always just, sitting them down at the kitchen
Amy
table and having the
Ronshausen,
drugs as
welcome to High
bad
Truths.
talk. It's making sure that we're living that life and we're walking that walk, and we're being examples for them as well.
Right. The issue of drugs is a national crisis in the United States, and especially with fentanyl, which just is unforgiving. One mistake can be a kid's last mistake, which is not fair. And I really believe that our nation is being attacked with 300 deaths a day, almost 100,000 deaths a year. Even if your numbers are getting better in Florida, it's still terrible. And you would think this would be a presidential issue, and yet I don't really see it as a big discussion point on Democrat, Republican. As they say, it's not a red issue or a blue issue, it's a red, white, and blue issue. But what do you see? Like, should this be on the forefront of our national debate?
Absolutely. I mean, I've only been in this field for about, a little over 25 years. And even I have seen this dramatic change of when I first started in this field. Well, what do you do for a living? Oh, drug prevention. And, now when I tell people that, I have to sit there and listen to stories about how they've lost a loved one, how they know somebody else that's lost a loved one. Everybody is impacted by this epidemic at this point. And I know we called an opioid epidemic, but really it's a drug crisis. It's a global drug crisis at this point. And I was in a presentation a couple weeks ago, and one of the representatives from the DEA was there, and he had a slide that to me was just so telling. And it was two different slides. The first slide showed the Sinaloa cartel and the Jalisco cartel and their distribution of fentanyl throughout the United States. And these were like light beams going to every single state in the United States. The next slide showed their global reach. And I was, I'm in this field and I was pretty naive to the Mexican drug cartels' global reach. They're in Asia, they're in Africa, they're everywhere. And so this should be a political issue. These countries need to protect their borders, protect the people that live within those borders from these dangerous substances. And I will say that although I don't hear a lot about this, in the US from our presidential candidates, which is very worrisome. I do, when we were at C&D, you brought that up earlier, there has been the Global Commission on Synthetic Drugs, and that's a US-led initiative where I believe when we were in Vienna in March, 30-something countries had already signed on, and I think that number has grown from now. So it's an international cooperation of people trying to shut down the supply of these illicitly manufactured synthetic substances. So there is a global call to action. I just really wish that this was a main talking point for our political candidates, because it's something that each and every American is dealing with at this point, whether it's the safety on our highways, the drain on our healthcare system, or the impact to our private lives. So it's very disheartening that this isn't a number one topic on everybody's minds.
Yeah, I agree. I do feel, especially in America, we're being attacked, and I think it's going to be really the parents who are affected that need to make their voice heard. And one such parent, I don't know if you know, James Rouse, founder of Families Against Fentanyl, but his mission is to get at the supply, because supply matters, and we can deal with the supply if we wanted to. And his quest is to declare illicit fentanyl a weapon of mass destruction. And we have more attorneys generals and political leaders around the country who are joining the effort to declare illicit fentanyl a weapon of mass destruction in order to get at that main supply chain. So I don't know if you've heard of that in Florida, but that is something that we're really promoting.
Yeah, that's wonderful. I call these people the people I wish I didn't know, but who I'm so grateful for, because these are people that I only know who they are because of the significant tragedy that's happened in their life, that they've lost a loved one, and usually a child, to this horrible disease. And but because of that tragedy, they're willing to tell their story, and they're making such a tremendous impact, way more of an impact than I can make at Drug Free America Foundation, that these organizations can make, because it's such a heartfelt message and it's such a reality. And so I'm just so thankful for people like that, and for all the other parents that are out there, or all the other people that have lost loved ones that are sharing their story and sharing their voice, because I can't imagine how difficult it must be, but they are really making changes. And so it's really great to have them on board.
Yes, they have that power to make a difference. And there are so many parents like that out there. And another one, just going to shout out to Julie Shamish, who was my partner on fentanyl testing in hospitals. We were able to write legislation that hospitals should include fentanyl when they do drug screening, which seems like a no-brainer. It's a 75-cent test. And if we're checking for marijuana or cocaine or methamphetamine, why would you not include the number one drug that's killing Americans? And I got nowhere with that idea until I partnered with Julie, who was able to lend her son's Tyler's story of going to the emergency department and then dying after a negative drug test. And we were able to bipartisan support in California and Maryland and Pennsylvania. And I'm pitching it to you now in Florida, because it's a very simple, it's not going to cure the world, but it does bring in the medical community into solutions. So,
Yeah, that's awesome. That's great.
yeah, so happy to help you out with that if you want to
Yes,
move that
absolutely.
along in Florida.
Yep.
So opioids, and interestingly, when I have patients come into the emergency department who've overdosed, I asked them, what did you think you were taking? Because I want to get them to treatment, and if they're have an opioid use disorder, I want to get them to the our MAT program. But oftentimes it isn't. But the other question I ask patients who overdose is, what's the first drug you ever used? And a lot of times they don't think of it as a drug, and then I said, no, when's the first time you ever used marijuana or weed? And I said, oh, weed. Well, I was 10, 9. They were really young. Just like we said, it's a pediatric disease. So it used to be people who overdose, you ask them what led you to this, and it would be prescriptions. But today when I ask patients, what's the first drug you ever used? It's marijuana. So speaking of marijuana, how do you frame that program, or do you see that connection with opioids and marijuana?
Oh, absolutely. And in fact, there was just a news article the other day that I was pretty shocked to see, even though I live in this space, that for the first time, more people are using marijuana on a daily basis than using alcohol.
Isn't that crazy? And you know what? That was the goal. The
Yeah.
marijuana industry, they set their goals out to rank the alcohol industry, and now they finally reached their goals. This is not by chance. This was planned.
Absolutely. Absolutely. A very they stuck to their plan, and they're meeting some of their goals. But yeah, it's again, when I first started in this field, there was only 5 or 6 states that had medical marijuana. And we were tracking that and watching that, and we saw the writing on the wall. And I have to say that, our kind of origin story, Drug Free America, was created by Betty Sembler and her husband, Ambassador Sembler, because in the mid 90s, they saw the push for legalization, marijuana as a medicine in California. And she sounded the alarm, and nobody believed her. They thought that this would never happen. Like this couldn't possibly happen. And so that was kind of the catalyst of Drug Free America being formed, because she wanted to get that message out there and wanted to be able to educate people. And we've just kind of broadened our mission since then. But it's always been and always will be, it's my job now to honor the legacy of the Semblers and make sure that I'm always working toward that mission that they've fought so hard for. And our organization will be 30 years old next year. So we have definitely grown along the way, but marijuana has always been one of the things that we've known is the catalyst to other drug use, a lot of our societal harms. And so a lot of our education is revolving around that. And when people talk about the opioid epidemic, it's worrisome that they don't connect marijuana to that epidemic. I mean, we have some statistics, and I'm really bad at that, but I think it was around 35% of people who use marijuana will then go on to abuse their prescription drugs or other opioids. So there is this, set of people who that is kind of a catalyst to their opioid use. And like you said, it's very rare to find somebody and ask that question when they're using opioids or they have overdosed and you're looking at their drug history. Almost all of them started with using marijuana use, as you said, in their early adolescence. So it's something that needs to be addressed. If we're going to address the opioid epidemic, we have to address early use of marijuana in adolescence. We can't ignore that.
That's right. It's going upstream. Downstream is naloxone and treatment. Going upstream from fentanyl is talking about marijuana, and going upstream from marijuana is dealing with life's challenges without going to drugs.
Absolutely.
Yeah. So what are you doing as far as policy work when it comes to marijuana? And there's so many different things. I know you're working on the hemp and Delta products or potency caps. There's so many, because this is so unregulated. People have passed this using American children as guinea pigs without regulation.
Absolutely.
And so there's so many different approaches that we can go through. What are some things that are making some traction, if any, in Florida?
So one of the programs that we're pretty proud of, and this is our second year implementing it. And again, this was the brainchild of Mrs. Betty Sembler. She came to us probably about 4 years ago, and she said, "Now, Amy, what are we doing about these babies who are being born testing positive for marijuana?" And I said, "That's a good question. Let me look into this." And the data showed us that since marijuana was legalized as a medicine in the state of Florida, and this was data from a couple of years ago, that the amount of women using marijuana during pregnancy had gone up about 300%. And, we don't know exactly why that happened, but in my humble opinion, it's the normalization of the drug. When somebody sees it as a medicine, when somebody sees it as legal, they think it's safe or safer to use. And there wasn't a lot of education around marijuana use during pregnancy, because almost all of our efforts towards pregnancy were geared toward the opioid issue. And in talking to some of the nurses that worked in the NICUs in our area, they said, yes, we still have obviously babies who have opioids in their system, but almost all of them, almost every single baby in my NICU right now also has marijuana in their system. And we're not doing much about that. So we were able to get a grant through the Florida Department of Health, which was the first time Drug Free America has ever taken state dollars. And it has been such a phenomenal partnership. And we created a marijuana neonatal task force, and we brought everybody on board who's already working on this issue in the state of Florida and said, we're here with resources to enhance what you're already doing. Go. What do you need? And over the last 2 years, we've created a online program for a training program that medical professionals can take or community members. And it's about an hour long. There's videos, there's questions. You get a certificate when you finish. It's free to use if you're in the state of Florida. Really, it's free for anybody, but we're marketing in the state of Florida. We created a whole campaign around reducing marijuana use during pregnancy and postpartum. And all of the campaign materials are in English, Spanish, and Haitian Creole. And they're one-pagers, infographics, videos, and memes for social media. We've had regional town hall meetings on this area. Some of them were on TV, and then some of them were just, a regular old town hall meeting. We had a statewide conference on this issue, bringing in experts from, around the U.S. to speak on this, and including Dr. Bertha Madras, who is always our favorite to listen to and always gives us so much wealth and knowledge on this issue. We've done webinars around this issue, and we've created a cross-platform digital campaign that targets girls and women in the state of Florida ages 16 or 18, whenever we're allowed to start marketing toward them on social media to the age of 35, with these ads to bring them back to a dedicated web page where they can learn the truth about marijuana use during pregnancy. And it's our second year. We're hoping we will get funding for a third year, and our third year, we will then be adding other vulnerable populations, which will be youth. And so we're really excited to be able to extend this campaign to really target the youth in Florida, because it's a really vital time for us, because our state is facing a ballot initiative to legalize and the commercialization of marijuana in November. So we know our youth are already being targeted by the messages from big marijuana. So we really need to work harder to counter those messages.
So that sounds like an amazing campaign. If other of our listeners want to see that, where would they go to?
So we do have some of the information on our Drug Free America website, which is www.dfaf.org, but also on our Marijuana Know the Truth website, we have a dedicated page just for pregnancy. And so all the resources are free. They're on there. You can download them, and we can even co-brand them if that's something that you're interested in. The goal is just to get this information out there.
That's awesome. So I'll include that in the show notes if anybody is interested, because that is definitely important. We have seen from the ABC, the largest longitudinal study that we have in the world, that neonatal use of marijuana results in long-term anxiety in children after they are born. So we know there are, and that's just one of the consequences. It's also genotoxics, not good for your DNA, and there are other consequences. But we've seen that, and so it's wonderful that you're getting that information out.
Yeah, I mean, it's so important because it's not only the health of the baby while it's in the womb, but we're looking at the health of that child through adolescence. There's something that is easily preventable. So just sharing that knowledge, we're actually expanding the program, and wish us luck here because it's going to be a big haul. We are expanding the program to Jamaica in 2025.
Wow.
Because we know that, marijuana use is pretty prevalent there, and sometimes for, religious reasons. But we think that if we can just target this singular population, and even if we can get them to not use marijuana just during pregnancy, that would be a huge accomplishment. And if they can stop using during pregnancy, then maybe that could be the stepping stone for them not using once the child is born. So it's a big lift, but we're ready for the challenge.
And people are so careful when they're pregnant, right? I'm not alcohol. I don't want to be around cigarette smoke. They're careful what they're eating. And it's amazing how marijuana gets a pass when you're so careful about everything else.
Yeah.
Some of the things that we've tried and actually failed at in California is warning labels on marijuana products, potency caps. We didn't even touch that because we couldn't even get the candy ban. Like, why do you need like candies that look like Cheetos or Oreos that are just targeted towards little children? And the number one poisoning in our country under the age of 2 years old is marijuana. We couldn't even get that through some legislation like that you're trying to, or you're just fighting the legalization and commercialization?
Yeah, both. We're looking at it at all ends. So we were very lucky that when medical marijuana passed in Florida, we had some very thoughtful legislators who allowed the anti-drug community, if you want to call us that, to have input on the implementation of the bill. And at Drug Free America, we looked at what happened in other states and actually called a lot of those regulating departments and said, if you were doing this all over today, what would you do differently to mitigate some of the harms? And so about 90% of what we asked for got put into our implementation bill. And we thought that that was so cool, and we thought that we had done such a great job, but there is such a difference between what's on paper and what's actually implemented in our communities. And so we see these big glaring loopholes. But one of the things that we were proud of, but still needs work on, is for pregnant women, only low THC is allowed to be recommended. And in the state of Florida, they define low THC as 0.08, nothing to do with the blood alcohol content of alcohol. But just so happened that that was the number that they picked. So we think that we have enough science and data now to show that no marijuana should be recommended to pregnant ladies. So that is something that we're pushing for, but at least we do have that one caveat in the bill. We also have right now, our medical products are not allowed to look like candies. And so if you go into a dispensary in Florida, they do look more like what you would think medicine looks like, but there's so many things available online that all of that kind of gets bypassed, and things come in from other states. And then there's always a push from the marijuana industry to expand what is they're allowed to do. And we do have a lot of rules on how they're allowed to market, but nobody is enforcing those laws. So we see a lot of inconsistencies, and in some ways we can't blame it on the legislation put all these rules in place and said that the Department of Health in the state of Florida had to regulate all this, but didn't give the Department of Health any money to regulate it. So, who is the enforcement agency? How are they supposed to do this? So it becomes very cumbersome. And, I'm very grateful that in the state of Florida, we have a very good group of coalitions who have been working on this issue since 2012. And they've stayed very in the know of what's happening. And on Advocacy Day, we go to Tallahassee once a year, and we come with 100 people, and marijuana is always one of our main talking points. So looking to cap the THC, looking to ban the Delta 8 products, looking to do all of those things is always on our agenda. And each year we get a little bit further. But then each year the industry throws us with some big pushbacks. And so now we are gathering forces to start our grassroots campaign to prevent the commercialization and legalization in Florida. So we know that one of the dispensaries here in town, True Leave, has already put $30 million into this ballot initiative just by themselves. And we're over here scraping our pennies together, trying to make a difference.
Wow, that's great. Well, good luck to you. And I wanted to share another bill that we tried in California that didn't get anywhere. But we figured the industry didn't want us to put labels on the marijuana products. So one of the things that we see in the emergency department is people have drug interactions. There are over 500 drugs that interact with CBD and over 300 medications that interact with THC, that we were going to just ask the pharmacies to put on an auxiliary label on medications that interact with cannabis products. Just like we have don't use with alcohol, don't use with grapefruit juice. We were going to have don't use with cannabis products. And again, I think it's a brilliant idea, but it didn't go anywhere.
So we actually have that in Florida. Now, whether or not it's being done, I have no idea. So part of the dispensing law says that every time a recommendation is filled, that recommendation has to come with something similar to what you would see when you get a prescription, that pamphlet that's always stapled to your prescription bag that talks about how you're supposed to use it, what the interactions are, what the harms could be, and that it has to say on there that it's not FDA approved. So
that's on the dispensaries, right?
On the products that the dispensaries dispense.
Right.
And so that's all we have right now.
We wanted when you get your prescription for a blood thinner from a real pharmacy, that it would say don't use with cannabis products.
Oh, so the opposite. Yes. Okay.
Right. Yeah. To have them warn this is a blood thinner. If you mix it with cannabis products, you have increasing bleeding. You could die. So, so that's kind of what we wanted to go the other way around, because we didn't think the cannabis industry would oppose that. And it's not that hard to do. You put in a computer program and they spits out these labels. So anyway, so
that's a good one. I might steal that one and try to work on it in Florida too.
Yeah, I'll be happy to give you the language and stuff. So happy to, wherever that happens. So a lot of amazing work that you're doing and sharing freely. And you also, what makes you special, Amy, is that you have really this global perspective. You just say, oh, we're working with Jamaica, where they have, increased marijuana use. You work with the World Federation Against Drugs. Tell us, what is that and what is their goal?
Sure. So I have been honored now. I'm on my second term as president of World Federation Against Drugs. In fact, our Congress is on Thursday, and I'm hoping to be able to serve a third term if the members will keep me. But World Federation Against Drugs is a coalition of like-minded organizations throughout the globe. We have almost 400 organizational members in more than 60 different countries. And then we have individual members as well. And they all are, they sign kind of that they'd abide by our Constitution, that we believe that the impact of drugs is hurting families around the world, that it's hurting individuals around the world, that it's having an impact on security around the world, and is undermining all of the sustainable development goals that are set forth by the UN. And we have a special focus at World Federation Against Drugs on the rights of the child. We particularly always make sure that what we're doing includes Article 33 of the conventions, which is the rights of the child. And that's basically that children have the right to grow up in a drug-free environment. And as communities, as adults, as governments, it's our job to ensure that that right is met. And WFAD works kind of on a few different pillars. One of them is ensuring that there is a gender-based approach to everything that we do. We have a big focus on recovery and and obviously prevention. And we like to showcase the work of all of our colleagues around the world because we're all facing the same global problem, but we can learn from what each other's doing. And, we have partners in the Middle East, partners in Africa, partners in Latin America, and partners in Asia. And treatment, prevention, recovery, while it's all the same, it's got different impacts in different places. And so it's really neat to hear the success stories and to hear the challenges that each one of our members are having, making sure that these missions are fulfilled. And it's really just giving voice to those things that are happening around the world. So it's a really cool organization. I get to meet so many wonderful people, but I'm just very lucky that they allow me to be part of this and they allow me to learn from all of the amazing things that they're doing, because selfishly it helps me in my work. So it's really great.
It is amazing. And it's also interesting what drug problems are specific to different countries and how they face that. So, for example, I think you work very closely with the African Union, right? And they have their unique challenges.
Yeah. In fact, we just did the Nigerian drug control office, so I'm assuming that's kind of the equivalent of the Nigerian DEA, contacted us and asked for a training on high potency cannabis and fentanyl. And so I brought in one of my board members who's a former narcotics officer, and he's a trainer for the National Association of Drug Diversion Investigators. And he does a lot of naloxone trainings and fentanyl trainings. So I brought him on board to help me with this. And him and I were talking and we're like, we don't even think that they have fentanyl in Nigeria yet. And I'm like, I don't think they have high potency products either. And so I'm back and forth with the group and I'm like, are you sure this is what you want us to cover? And they said, yeah, because we want to hear what's happening in the US and we want to be ready for it. And so they wanted to know what the impacts were of these high potency products. They wanted to know how to use naloxone. They wanted to hear how fentanyl was being distributed in fake pills. They wanted to learn all about it. There was 300 and something people on this webinar. They must have asked hundreds of questions. They were so engaged. They were just so thirsty for the information because I don't think that people are providing that kind of training and resources to that part of the world. But what was very interesting is a lot of their questions focused around if the US government knows that all of these bad things are happening in the states because of the legalization of marijuana and the accessibility of high potency products, why are they letting it happen? And I don't have an answer for that, I was just like, well, that is a very
one of the answers to those things is follow the money, right?
Yeah. And but it's so neat to see that perspective, to see like they saw the slides, they followed the information, and for them, they just couldn't understand how we're allowing this to continue and how we're allowing this to happen. And we're allowing this industry to grow in our country when it has nothing positive and only negative impacts. And, but they were very hungry to learn about that. And just like big tobacco, just like big alcohol, big marijuana is trying to get their foothold onto the continent of Africa as well. So the African Union is very aware of this and is working to educate the countries in Africa on the harms. And when you look at what's happening in the US, we know that it's horrible and we know that it hasn't worked out well, but we also have to acknowledge that we have a pretty robust regulation system. Can you imagine what this would look like in a country like Africa, in some of the countries like Africa, who have no infrastructure and no regulatory system? It would be even more devastating for them. And they're just following the lead because that's what they do a lot of times on what the US is doing. So it's very scary.
It's also sad that we are such a negative example for the world of on the issue of drugs. The other thing that really intrigued me with the African Union is I forgot the percentage, but a significant percentage of the entire population of the continent is under the age of 25. So they're susceptible in a large way to marijuana and the issue of drugs, and why they're really doing whatever they can to avoid that.
Yeah, absolutely. And we have the same, a very similar statistic for India as well. Like the largest part of the population are very young adults and adolescents. And so, that is the most vulnerable population. It's also the largest population. And also, I think that that's what's triggered the industry to go into both of these countries and this continent, and into the country of India is also facing legalization pushes as well, because they see that growing base for their products and so much bigger than what they have in the United States. And so, like you said, it's all about the money. It's all about profiting off of addiction and getting these kids while they're young to be involved in these products, and they're marketing specifically toward them now.
Yeah. Now, one thing I've seen you talk about when it comes to drugs is also tying in the issue of human rights. Can you explain that?
Sure. So for the last few years, and maybe even longer than that, there's been this push from the S.O.S funded groups to see drug use as a human right. And there's, oftentimes we are in meetings where we're promoting treatment, we're promoting recovery, and we get a pushback that instead of promoting those things, we should be educating on the safe ways to use drugs, because it's somebody's right to not only use these products, but to use these products in a safe place, and that the government should be providing the drugs, they should be providing the ways to use the drugs, and they should be providing the safe spaces to use them. So people in the prevention, treatment, and recovery arena really haven't been focused on the human rights aspect. That's not the sphere that we've been in, but we're moving there because what's being ignored in a lot of these policies, especially when it comes to harm reduction, is the rights of the child. And so a lot of these strategies, these harm reduction strategies, are singularly focused on the individual and not the community, not the family, and not the children within that community. And we know that the disease of addiction impacts way more than that individual. And just like when we talk about recovery isn't something that's individualized either. Recovery is celebrated because the family is now a part of the recovery. The community is part of the recovery. And so we see that a lot of these harm reduction strategies are very singularly focused, and they're very standalone focused. And it seems to be in the human rights realm that they're looked at. And so we're really working to kind of push back against that and to recognize evidence-based harm reduction strategies, but as they fit within a continuum of care, meaning that we understand that not everybody's ready for treatment, and we need to help them and give them some strategies that they can use until they're ready to get there. But any harm reduction strategy needs to be with the end goal of recovery. And so kind of a recovery oriented harm reduction strategy. And that's kind of what we've been pushing, because we know that even in the US, our national drug control strategy now involves harm reduction, but it's not clearly defined and nobody really knows what that means. And there hasn't been a lot of looking into the strategies that are being implemented in some of these communities. And by that, I mean, some harm reduction strategies seem to come from a public health model, but that public health model isn't incorporating the disease of addiction. And sometimes I jumble my words up when I say this, but when we're looking at needle exchange programs through a public health model, do they reduce infectious disease? Absolutely. Are they encouraging people into treatment and recovery? Only if they're commingled with screenings, brief interventions, and referrals to treatments. And only then can we count it as part of a model that includes addiction and substance use disorders. And so sometimes I think that we look at things through a public health model, but forgetting that addiction is a chronic relapsing disease of the brain. And so somebody who's in active addiction is very different from somebody who just has an infectious disease. And we have to implement strategies that are going to accommodate the needs of substance use disorders in addition to infectious disease.
Yeah, I was astonished the first time I went to Vienna and at the United Nations C&D committee and saw people say openly that you have your wine, I'll have my line, and are promoting active drug use in an area where we're trying to prevent and develop, or I thought that we're trying to prevent drug use on our world.
I think that that's a very European American privileged statement, because somebody who's saying that they can use drugs responsibly, I don't think that that's true. But for example, if I decided to start using drugs and I became addicted to drugs, I have a really great healthcare policy that would allow me access to the treatment I would need to recover. I also have a robust support system with family, friends, and colleagues who would help me along the way. And that's a very privileged place to come from. To say that somebody can use drugs responsibly who doesn't have that kind of network and support system and access to care is just mind-blowing to me, because the majority of the globe doesn't have that. And so when you're promoting drug use to the continent of Africa, to Asia, to some of these other countries who don't have the privileges and access to treatment that we have in Europe and the United States, you're setting them up for failure, and really you're condemning them to a life of addiction and the burdens of substance use, because they're not going to be able to overcome that. And that's what's really sad, is that these policies of it's a human right to use drugs are only being spouted by these very privileged countries and individuals.
That's interesting perspective, and it's absolutely right, because in other countries, if you have a problem with whether it's alcohol or drugs, you're kind of left on your own. You don't get these second, third, fourth, 9, 10 chances that we give people.
No, and if we talk about this as a pediatric onset disease, most countries don't have treatment for adolescents for substance abuse. Like, that's something that we only have in the United States and in some other European and South American countries. But the majority of countries don't have treatment centers for our youth. And if that's when they're going to become addicted, how are we going to help them?
Yeah, it is sad. So the United Nations is an interesting place, and we've seen different countries who, the other thing that intrigued me, that you'd think would be enemies, may actually have similar goals when it comes to issues of drugs. I remember there was at one conference, each country kind of talked about their issue, and I was intrigued when Syria talked, a war-torn nation, and very much against marijuana because it was affecting their young men, that, the soldiers to be, that was destroying them. And I thought, oh, what a wonderful idea. If I was at war with Syria, I would just want to give them a lot more marijuana and high potency, because that would, help me in military strategy. They basically said that. But how do they play nice? We have different global issues and wars going around in the world today. How do these countries play on the issue of drugs, like Iran and the United States and China, with the opium war history that we have?
Yeah, so as a member of civil society, I don't get to attend a lot of those meetings where the government officials would be in them. I've got to observe some of the meetings, and I think, you're right. There are some countries that, you think that politically we're not aligned with at all, but then you would hear that we actually are aligned somewhat on our drug policies. And so I think that there are some partners around the world that we can agree on some things and obviously disagree on a lot of other things. But I do think politics come into play a lot of this. I think most of that is behind closed doors. And as members of civil society and non-government organizations, we don't get to see a lot of that. But I also suspect that the people that are there, they're working in this field. And so, just like in the United States, the people that come to the UN are people that are specifically working in drug demand and supply reduction. They probably aren't at the table when we're looking at conflicts or, other parts of, policies. And so I suspect that some of the people that come from the other countries are also focused on these issues. So it allows them to kind of leave everything else outside the room and just focus on this one issue. And sometimes I think they do that, but then also when you see that there's resolutions that are being voted on, just like in the United States, when it comes to voting on legislation, it seems to go down party lines. And I think sometimes politics does play a big role in what's happening on the UN drug scale as well. And I think this year, we could feel some of those tensions in the room more than we have in years past, with what's happening in Israel and what's happening in the Ukraine. There's a lot more conflict going on, that, some of these things are happening a lot and we don't necessarily know a lot about them, but these were two really big issues that the whole world is kind of vested in at this point. And I think that you could feel some of those tensions this year at C&D, and you could see in some of the people that were not represented. And in fact, even for the luncheon that we hosted, we had member states coming, and I was getting some questions on, are any member states going to be here from this country? Because if so, this country isn't going to attend. And I've never had that in the past.
Wow. So that did affect, at least at that level, drug policy.
Yeah.
The other thing that surprised me is that the conversation was about marijuana, a lot of talk about marijuana. And I thought the big discussion would be fentanyl, and yet that was not something that was a big issue on the United Nations level.
Yeah, and I think that that's because, fentanyl, even though, like I said, from those DEA slides, we saw that the illicitly produced synthetics are, spanning the globe now. It's a newer thing, where marijuana has, been around for a long time. It is, prevalent in every single one of these countries. And it's something like, like for us, alcohol, tobacco, and marijuana are things that we're always pushing back against, because we know that these are the three main substances used by our youth. So it doesn't matter if they're legal or they're not legal, they're still the most accessible to our youth. And that pretty much is the same in other countries as well. But we do see the threat of synthetics. I saw it talked about more this year than in previous years. And I think that that's because of this global task force that was created to address this issue. And I know that it's a big focus for the US, and that's why they're leading this effort. And so I think that when we go next year, I believe there'll be even more of a conversation toward that. But I think that this year was some groundwork was set for some of these countries who don't see any of this yet. I mean, in some countries in Africa, their extent of the opioid crisis is just the use of tramadol. Like, they're not even seeing oxycontins and the things that we saw. They don't have the benzodiazepines that we have seen that people have been using, or the Adderalls or things like that. Like, the extent of their prescription drug diversion is tramadol, which is harmful, but they haven't grown to what we've seen here in the US. So I think that all this is kind of coming, and it'll be I think each year it gets bigger and bigger, but marijuana will always be there. It will always be probably one of the main focuses, because you have such a push in every one of these countries to legalize, just like we have here in the States.
Yeah. Yeah, it's amazing how things are just backwards. And I'm now at the point where I hear people at public health meetings say that, oh, more people are helped by illicit drugs than are harmed. And, the language is a complete 180 than what the science tells us, right?
Yeah. Yeah.
So,
and it's weird because we've learned so much during COVID to follow the science, but for some reason that follow the science doesn't equate to the drug issue.
right. Follow the science unless it doesn't follow my political motivation, which I guess could bring us to the next topic of discussion: rescheduling of marijuana. Now, a big push before the presidential election, not following the science. What are your thoughts on that?
Well, I mean, I don't even know where to begin on this. I'm shocked that it's gotten as far. I mean, I'm somewhat shocked that it's gotten as far as it has without the backing of science. This is something that's come up every few years. There's been this review, the DEA has reviewed it, the FDA has reviewed it. It's always been reviewed. But they've always really followed the science, and they've looked at that. And now it seems to be a political ploy. And that is really, disheartening. But also, I think it's going to be a very slippery slope, because if we can reschedule this, it's going to be that much easier to start rescheduling other drugs. And while I know that might seem that it's a stretch to some people, look at what's happened since marijuana legalization. We've gone to, other hallucinogens, the LSD, the mushrooms, and, it's this ongoing plot of that camp, that it doesn't just stop with marijuana. It stops with the legalization of all drugs. So I think that I think it's a slippery slope. I think it's something that they're doing without the guidance of science behind them. And, I'm not sure how to stop it if it is a political ploy. We can bring all the science that we want to the table and all the data to the table, but if they're not going to listen to it, that makes it harder for us to fight.
There's all the drug issues that we know of, but as a physician, I think it destroys the integrity of medicine, of practicing medicine. I mean, you count on the FDA process for approving new drugs, for risk-benefit calculations, for studies, and we trust that process. And if you could just circumvent that process and say anything is illegal, that doesn't follow the science. I mean, the science was done. The FDA has labels on Marinol and Epidiolex, on certain chemicals within the marijuana plant. I could write a prescription for those. The science is evident. And now to say, oh no, this does this, right? The whole plant and all the carcinogens in it are fine. It doesn't just affect marijuana. It affects every medication from now on that I want to prescribe. What is the point? Like, we're working for years now on a sequestrant for methamphetamine. And it's a great drug, but it has to go through the approval process that the FDA sets to make sure that it's safe. And, we have phase 1 studies, but this drug will actually sequester methamphetamine and eliminate from the body in minutes. Great potential, but you can't just say, oh, it's okay, let's just approve it for everybody because it's a great idea, because we have science to follow.
Yeah.
So what's the point of any medication like that when you could just say, oh, no, this is a good idea. Let's just legalize it because we want to.
Yeah. And I know that the FDA is not perfect. And, we've all had our, issues with it when it comes to especially the impact on the opioid issue. But the reality is it's the most rigorous process. And other countries, they look to our progress that we have, and it ensures consumer protection. And so anything outside of that is going to be detrimental. It erodes the whole process of medicine, but it's also detrimental to our health. And it's like going backwards in time. Instead of advancing with medicine, we're like declining.
No, we're going to go back to snake oil.
Yeah.
After years of trying to have a higher medical standard. Yeah. So that's one thing as far as degrading medicine that, as a physician really speaks to me. But the other one, I've heard on the floor of the United Nations, and that is the United Nations has a process for scheduling. And if the United States can unilaterally make up their own and break national treaties, then why should other countries care about other treaties, like how we deal with nuclear power? Like why should other countries trust us when we break these kind of treaties to honor other treaties?
Yeah, especially when we are, we encouraged a lot of the other signatories on those treaties. And now we've kind of are breaking with what we asked other people to do. So it really is, I think that the impacts are going to be, there's more than we can even fathom right now, and they're going to be long lasting. And I think that you have to look outside of this particular issue too, because like you said, if we can discount this treaty, why would people think we just can't discount another treaty? And it just makes us, less reliable. And I think it'll make people less willing to work with us in the future. And that's not something that we should be striving for. We need to be world leaders when it comes to things that are helping mankind, not, reversing our stance on things.
Yeah. So Amy, congratulations. 30 years with American Drug Free Foundation. Is that even a possible goal, to be drug free?
I'm not sure. And I know that it's a very lofty one, but I don't think with any other public health issue, we would say we want to, we just want to reduce childhood hunger. No, we want to end childhood hunger. So I think for us, we will continue this hope of having a drug-free world because we really can't settle for anything less. Our youth deserve an environment that's drug-free, and we deserve a world that's drug-free. And so it'll always be something to strive for, and I don't think we should strive for anything less.
I agree. That's the gold standard. You don't always reach the gold standard, but you should claim and own and be proud of the gold standard. And the good news is with our data is that we're seeing more young Americans, more kids make that choice to protect their brain until age 25 and not use tobacco, vaping, alcohol, marijuana, or any drugs. And with that message can be heard. Not 100%, but the majority. And I think we are collectively getting that message across.
Absolutely. And I think that that's something to be very proud of. I think that, the more people that we can have that are choosing sobriety, not because they're in recovery of something, but they're choosing sobriety for reasons of health and reasons of being successful and wanting to live out their life the best way that they can, especially for youth to see that future. That's unstoppable on their end, and it's something that we should be really proud of.
Yeah, and thank you. And I want to also say thank you to Amy, also being very generous in inviting me and my colleagues to Vienna to learn, to share what we know as physicians. I'll always be grateful for you for that, for teaching us, and continue this strong partnership.
Absolutely. This is, it's selfish on my end because you guys get to educate a whole bunch of people on your areas of expertise, and everybody enjoys learning from you. And we're happy to have you as part of the team.
Great. Thank you, Amy. And good luck with all the great projects.
Thank you.
Thank you for listening to High Truths on Drugs and Addiction, where you learn from experts from around the globe and around all aspects of drugs and addiction. This week's episode would not be possible without the generous support of our sponsor. A sincere and warm thank you to Physicians for Healthy Communities. Visit physiciansforhealthycommunities.org and view their video and resource library. High Truths producer is Dave Rivas from Davey Boy Productions. I'm your host, Dr. Ronit Lev. We hope we brought your day a little bit more high truths.